Hospice and Palliative Care of Westchester is so much more than you think.
Hospice entered our life at a very difficult time and gave us the tools and the time to be with my dad. And when we couldn't be there, I felt I had this amazing new member of our family that gave him the same amount of love, the same amount of compassion as we did.
He arranged for us to get into hospice, and our focus shifted from trying to extend Mom's life to trying to ensure that it was as comfortable and dignified as possible for as long as possible.
The worst part, I think, of Scott being sick was seeing him in pain. And when he was in treatment, there was a lot of pain. And when he was in the hospital, there was a lot of pain. But with hospice, there wasn't any pain. They managed his pain so well that he wasn't in pain. That was good.
I was involved over 20 years ago, representing White Plains Hospital to establish a community-based, freestanding hospice program that would meet the needs of the residents of Westchester County and care for them at the end of their life. It was not a service or a care modality that was very well developed at that time, and it was the feeling in the community that everyone in this community would benefit from such service.
Hospice is there to take care of a patient with a devastating illness, but with the understanding that that illness affects not only the patient on every imaginable level, but it affects the family on every level as well. And we're there for the patient and we're there for the family.
So I provide a lot of the medical support and direction for the pediatric palliative care team. We have team bi-weekly meetings where our entire team gathers and goes over in detail each child's situation and case. In the meeting, we involve both medical attention for the child through nurses, we have social workers there, we have chaplaincy, we have child life, music therapists, pet therapists, and together is where we can provide complete care for the child.
As a social worker, when I come into the home, many times the family's in a state of crisis. They have a diagnosis maybe that they weren't expecting, or they've been told that the patient may be close to the end of life. And so I try my best to bring in sort of a calm presence, listening to the family, encouraging open communication, joint decision making, and really helping them to sort of understand that there still is a lot that can be done at this time in their life.
When it comes to the end of the life, a lot of people feel uneasy. And this way it brings families together, brothers and sisters. I mean, you don't always get along, but this is the time when you need to pull together. This is what true family is when you take care of someone on hospice.
It's very important that in hospice, the real core of hospice is 24/7. And families need to know they have that backup all the time. Whether it's a holiday, a weekend, after hours, they need that care and guidance. It's our job as professionals to provide that.
Hospice is misunderstood in the community at large. It is viewed as a place where people go to die. That is not true. It is viewed as the fact that you must have a cancer diagnosis to come on to hospice. That is not true. And it is also viewed that you must have a very short lifespan remaining to be signed on to hospice, and that is not true.
My dad had dementia, so he didn't really know he was dying. He did, he didn't. But the respect and the compassion they showed him and gave him the love he needed, so not as much preparing him to die. They helped me prepare to help him die. But they gave him the love, the compassion, and the respect that he needed at such an important time of his life.
The team that came in, the nurse, the caregiver, the therapist, I thought they went above and beyond what they had to do. My wife loved each and every one of them. These are total strangers that we never saw and we never associated with. And my children accepted them as almost family members.
We provide nursing services, social work services, volunteer services. The volunteers add a second dimension of listening, being a friend.
Because of our fundraising ability, we're able to offer complimentary care to everyone at no fee. And this includes massage therapy and acupuncture and pet therapy, and these are things that would not be provided for otherwise if we hadn't raised the money.
When we come in and offer those kind of things, it just brightens everyone, and the reaction of the patient is incredible.
The burden is lifted from them at this time through our fundraising efforts and through these programs that are provided free of charge.
And we met a wonderful woman, Anna Sheriff, and she has opened up her pocketbooks. Hundreds of families have been able to get special care, complimentary care that they would not be able to get had it not been for her generosity, and hundreds more will be able to share the same kind of care that Anna has allowed us to provide.
We have a bereavement program which provides bereavement services to families for 13 months after the patient has died. Those services are totally uncompensated, and yet they are very important to the overall hospice program. And one of the reasons that we do fundraising, that it is a necessary part of our existence and something for which we as a not-for-profit rely on.
Every day was a gift. Every day was an opportunity to say those things that need to be said, and we wouldn't do it any other way if we had a chance to do it over.
It was an honor to take care of him. I was very lucky to be able to do that.
Hospice enabled my mother to have her life end in a way that was not demeaning to her, where she wanted it to be, surrounded by whom she wanted to have, and as pain-free and as discomfort-free as possible. It's a debt we'll never repay.